Okay, so let's start first from Singapore. Okay, they said in Singapore that the level of thrombocytopenia does not necessarily correlate with the severity of bleeding. So there is no way that we should correlate with the thrombocytopenia with bleeding. There is no correlation. There is no strict correlation. Why is this so? Well, because of this study from Thailand. Okay, there are important factors that may predict bleeding, and the most important is number one, the duration of shock. Okay. So you control shock, okay, probably these patients will not bleed. Other factors will include ingestion of NSAIDs, okay, use of plasma expanders, and persistent and prolonged high fever. Now, you bleed in dengue not because of thrombocytopenia. It's an interplay of your hemostatic mechanism, okay? So you have vasculopathy, which results in shock. You have platelet dysfunction, and you have coagulopathy, okay? Now, let's go to Malaysia, okay? No role for preventive transfusion. In other words, your patient is not bleeding, hemostatic profile is abnormal, no advantage in transfusing and not transfusing. So even with PPS, 2008, we never advocated preventive transfusion. Therapeutic transfusion, probably. And what are the things that you may use? What are the components you may use? Red cell, fresh whole blood. The jury is still out with regards to plasma products, but you can use it in severe cases of bleeding. So in other words, preventive transfusion, no. Therapeutic transfusion, most likely. Okay? Now, let me go to the first question. By the way, what's the first question?
Okay. The first question is a case of a 5-year-old dengue with a hematocrit of 45,
okay,
platelet of 90, a febrile, but with gum bleeding and epistaxis.
Okay, so the question is, will I transfuse the patient? Answer is no. Two reasons. One, type of bleeding. Usually, mucosal bleed, such as gum bleeding, epistaxis, these are very, very minor bleed, okay? So unless the abdomen is distended, there is no way I'm going to bleed. Second, that platelet count of 90 is very high, okay? Most CPGs, the transfusion trigger, if you have to transfuse with patients with thrombocytopenia, is around 5,000. So 90,000 platelet count is very safe. So definitely, I'm not going to transfuse this patient. I would just go with fluids.
The second one?
Second one
is a 7-year-old dengue on the 4th day of illness,
okay,
hematocrit of 48, platelet count of 19,
okay,
but otherwise has no bleeding and warning signs.
Okay, this is a typical case among us clinicians. Do we treat the patient or do we treat the laboratory? Okay. Obviously, this is preventive transfusion, okay? Again, my answer is no, I'm not going to transfuse this patient, okay? There are more important things with this patient. Have you taken a look at that hematocrit? That hematocrit is 48, definitely very high, okay? I control that hematocrit, probably this patient is not going to bleed. So I'll be more concerned with hemodynamics rather than hemostasis in this patient. And then the third question.
So your thinking is, even if the platelet count is below 20, if the patient looks okay,
yes, I will not transfuse this patient.
To transfuse, because in a few hours it's going to rise.
Yes, I'm more concerned with that hematocrit rather than with that platelet. Personally, I look at the platelet as a sign of activity, not influencing me whether I'm going to transfuse this patient or not. Okay, so it's an activity of the disease.